Hello, and welcome to our 5-minute medication review. Today, we're going to be talking about dopamine. Its trade name is intropin, and it's classified as a sympathomimetic, mimetic meaning mimicking. So, dopamine mimics the sympathetic nervous system. It's carried 400 milligrams in 250 ml bags, and currently, we do not stock dopamine in our drug boxes. But the way that dopamine works in the body, it is an endogenous catecholamine, meaning it's made within the body naturally. It acts on both dopaminergic and adrenergic neurons. Remember, this is primarily in your sympathetic nervous system or your fight and flight nervous system. So, this will inherently increase your blood pressure and heart rate and contractility of the heart. So, dopamine is very dose dependent, and we would typically give dopamine as infusions, and it is weight based. So as we go through these, they all will have different type effects because it is dose dependent. So when we give dopamine at, like, let's say 1 to 2 micrograms per kilogram per minute, what that does is it will dilate renal and mesenteric blood vessels. So this is blood vessels that supply your intestines and your kidneys. Typically, there's no effect on the heart or blood pressure, so it would, in essence, increase the flow of blood to those areas. In 2 to 10 microgram per kilogram per minute ratios, you have beta effects. And basically, these beta effects are on the heart. So, this will increase cardiac output without generally increasing the heart rate or blood pressure. So, this is kind of that perfect inotropic response. So, it increases your squeeze of the heart, but not necessarily increasing your rate or blood pressure. As we increase the dose to 10 to 20 micrograms per kilogram per minute, you will see these alpha peripheral effects causing peripheral vasoconstriction, which results in systemic vascular resistance and increasing blood pressure. So, this is kind of more of these alpha increased blood pressure effects the higher we go. And then the pure alpha effects is way up there at 20 to 40 micrograms per kilogram per minute. These are these alpha effects that reverse dilation or renal mesenteric vessels. So this actually decreases flow to the kidneys and the intestines, and it increases the heart rate and oxygen demand to undesirable limits. So this is a very dangerously high dose of dopamine. And when we infuse these in the field, we're doing this without any pump. And we're doing this on just purely titrating with a roller clamp and getting the right drips per minute, which can be kind of dangerous because you can have some runaway infusions that happen. And we don't carry dopamine anymore, so it's not really a concern. But you may find it, you may see it in the hospital, you may see it on critical care rides. It is still an AZDHS drug. So, some indications is to treat refractory cardiogenic or distributive shock. And so, cardiogenic shock is obviously involving the heart. And distributive shock, to help you remember what distributive shocks and the types are, just remember the word sand. So, sand um, involves, there's three primarily types of distributive type of shocks. Sand, the S is for septic shock, A is for anaphylactic shock, and N is for neurogenic shock. And the D stands for distributive, just to help you remember. Now, what these are is basically all these three types of shocks include widespread vasodilation. Okay. And the key here to treat that is we give dopamine to cause that vasoconstriction. Okay. So, some absolute contraindications for dopamine is hypovolemia. So, we wouldn't want to give dopamine for hypovolemia. We really want to focus our treatment on giving fluid resuscitation to those patients and any type of dopamine allergy. Now, there is a whole slew of side effects and precautions with dopamine. So, some things that you might see happen, tachyarrhythmias may occur with an infusion. And if you give too much, and you should kind of be titrating this and stopping that. Some high doses, usually greater than 10 mics per kilogram, may cause peripheral vasoconstriction, and it should We should not be adding sodium bicarb or other alkaline solutions since dopamine will be inactivated in alkaline solutions. Consider hypovolemia and treat this with appropriate fluids before dopamine. So, with any type of patient that is hypovolemic in nature, we want to treat with fluids first. And then dopamine is best administered by infusion pump to accurately regulate it. And so, remember, it can't be hazardous when we're trying to eye this without a pump, and it could be very dangerous. So we have to monitor this closely if we're ever giving this in the future. But currently, as it sits, dopamine is not listed in any CAREM's guidelines that we have anymore. It was removed, and we do not carry this drug in our drug boxes anymore. I hope you learned something about dopamine. Thank you for listening.